Yes, that's my cue, huh? Well, I'm Bob Turner, and I've done orthopedic surgery in Columbus for almost 40 years. I had a pretty busy practice. My patient satisfaction scores were great. In the last several years, I got all sorts of awards for extra stuff I did, mostly out on high school athletic fields with the Columbus City League. In short, I thought I was doing everything right. And a couple of years ago, I got a letter from the State Medical Board of Ohio. They said I wasn't doing everything right. They evaluated my prescribing habits and said I was below minimal standards of care. I was absolutely shocked. I just didn't have a clue. So I sat back and looked at my practice. I thought, you know, I don't even treat chronic pain. I'm a surgeon. People come to me with a problem, I fix it, and they go away, and usually they're happy. And what I learned was that, for the most part, I was correct. But I wasn't completely correct. Nobody can treat everything perfectly. So when I had a bad patient, and there weren't very many of them, but over the years, they add up. I was never very good at saying, there's nothing more I can do for you. I said something like, well, let's try to figure it out. And while I was trying to figure it out, they asked more Vicodin. I usually said, sure, why not? Well, that's wrong. I didn't know that. There's nothing in my training that said that. The opioid crisis didn't exist when I went to medical school. The DEA didn't even exist when I went to medical school. But I didn't know about the opioid crisis. I didn't know about Dr. Johnson's House Bill 93. There's nothing in medical school curriculum. There's nothing in our orthopedic training program. There's nothing in the orthopedic literature. There's nothing that I came in contact with that would prepare me for that. Well, the State Medical Board did take my license away. And about that time, I learned all sorts of interesting things. For one, I learned that I wasn't alone. There are literally hundreds of people in the state, and they weren't bad guys. They weren't running pill mills in southern Ohio. They weren't writing prescriptions for themselves. They were like me. They just didn't know any better. And they weren't screening for abuse and diversion. They didn't know it existed. I learned a lot of other things. I learned that losing your license just tipped the iceberg. All sorts of other things happen when you lose your license. You lose basically everything that is important to you professionally. You lose your hospital privileges. You lose your malpractice insurance. You lose all your insurance contracts. You lose your job. All those things say that you have to have a medical license, and you can't do those if you don't. The biggest thing that I really learned is all those people don't have to take you back. The medical board took me back. I got my license back in 6 months, but a lot of those other organizations don't want anything to do with me anymore. So at age 64, I had to start over. That was fun. And it was all an education thing. You know, if I'd have known a little better, I don't think I'd have been here. So as I look at SmartRx, this is just a huge first step. It's not the only thing that needs to be done, but my message to practitioners is, if you're going to manage chronic pain, and in this state that's defined as anything that requires treatment longer than 90 days, you need to learn how to do it right. You need to know how to screen for abuse and diversion. This is a great way to start, and it just needs to be done. I don't want prescribers to not understand what they're doing and contribute to the problem, and I don't want them to lose their license. Thank you.